Coronavirus disease, COVID-19, is an infectious disease caused by a new virus. The disease causes respiratory illness, like the flu, with symptoms such as a cough, fever, and in more severe cases, difficulty breathing. Coming up, we will talk about how coronavirus disease, COVID-19, is affecting the Polk community and the steps you can take to combat it. Less than a month after the first cases of COVID-19 were confirmed in Florida, to date the state has nearly 2,000 cases, including 23 deaths, as a part of the global pandemic, according to the latest numbers from the Florida Department of Health. Joining us in studio is Dr. Joy Jackson. Dr. Jackson has been the director of the Department of Health in Polk County and the Department of Health in Hardee County since September 2015. Prior to this role, Dr. Jackson practiced general internal medicine in a large multi-specialty clinic in Polk County from 1988 to 1998. In 2011, she joined the Department of Health in Polk County as a senior physician, becoming medical director in 2012. In this role, she helped to oversee provider staff and served on multiple committees, both within the health department and in the community. Dr. Jackson, welcome to the show.
Thank you.
We heard in the intro what coronavirus COVID-19 is. I want to talk right now, really, who is most at risk?
Well, actually, coronavirus is sort of an equal opportunity infection. Because it is a novel virus, that means none of us have ever been exposed or we're not immune to it. So really anyone who is exposed can contract the disease. When we talk about risk, we're generally talking about those who are at risk of having severe effects or complications from it. The people that were most concerned with having severe complications, including respiratory failure and death, are generally our older individuals, individuals over 65 years of age, anyone with chronic health conditions, or any conditions that impact their immunity. Perhaps someone that has had a cancer diagnosis or undergoing chemotherapy, perhaps somebody who has a genetic issue where they're autoimmune or immunodeficient, somebody with chronic diabetes or heart disease. Those folks tend to be more at risk of any infection, but COVID-19 seems to impact them the most.
I want you to talk a little bit about the importance, if you know that you are one of the at-risk groups, what you can do.
It is highly, highly recommended if you're an at-risk person that you stay as close to your home as possible, particularly in our over 65 population. So there have been a lot of restrictions put into visiting at nursing homes and ALFs, adult living facilities, to protect folks in nursing homes. But if you're at home and you're over 65, it is strongly advised that you stay there until we see what's going to happen with this infection. I know in my home, I've got two members of my household that I'm the only one that's venturing out, and we utilize ways to get food in, and then I'm very protective when I come home to wash up before I give hugs and kisses so that I can help protect my family. So my focus is when I go home is to protect my family. And I think these are things we can all do in our community. So think about what you can do to protect yourself and the people you are around.
We heard in the intro some of the numbers across the state, but talk a little bit about what the status is within Polk County, if you would, please.
We had our first identified case of COVID 8 days ago. March 17th, we had our first identified case. Since that time, we're up to 15 cases now. So when a case is identified, my epidemiology staff is notified through a computer system. Those cases are assigned to an epidemiologist who makes contact with a person that has COVID. We want to assure and ensure that they're staying home, and that if anyone else in the household if there's anyone else in the household that's not symptomatic, that they're kept separate. The person with COVID needs to be in a separate bedroom, utilize separate facilities, and that things are cleaned. We then also conduct what's called a contact investigation. We want to know who the COVID case person has been in contact since before they were ill. So we can reach out to those individuals to see if they have symptoms and to suggest strongly that they separate themselves from the workforce and from their family members until we see if they're going to develop symptoms. So these are critical things we can do to help ensure that the disease does not spread within our ability.
Now, beyond that, what's taking place locally as we speak?
The Department of Health in Polk County has stood up an information center. So we have nurses that are manning an information center in DOH Polk that we field around 250 to 300 calls a day. The information center has been open Monday through Friday from 8 to 5. We're now going to be open 7 days a week. So we can field questions from the public. Some people will call in because they're afraid. Others will call in because they think they've been exposed. Others will call in because they think they need to be tested, they've got symptoms. So we work with individuals to help decide whether we should help them get tested or whether we refer them back to their healthcare provider. We also in the call center are talking with healthcare providers and hospitals. We're a resource for fire rescue, for our first responders, because a lot of our efforts are also making sure that our people that are dealing with the public are as safe as possible. Absolutely critical. Not only are we protecting our elderly people, but we've got to do what we can to protect our healthcare workers and our first responders. We need to keep them working and in the field and doing what they need to do.
One of the things about being a resident in Florida is that we always have the potential for hurricane, and who would have thought that hurricanes could prepare us for this? A lot of work goes into this, and community partners make a difference. Talk to me about some of those community partners that are working on this.
I could not agree with you more. Because we've had the misfortune of having several hurricanes recently, we've gotten to know our community partners very well. Our emergency management system in Polk is extraordinary. We have a very good relationship with county government and emergency management, and through that, through the Polk Healthcare Coalition and our relationship, again, with local first responders, hospitals, and healthcare, I think that we are as integrated. There's always opportunity for improvement, but there is a great deal of opportunity to work together, because COVID is something that is not just a Department of Health issue. This is community-wide. It involves business owners' decisions. It involves government decisions. It involves personal accountability. So the integration of what we're doing, the messaging, and our collective desire to reduce local cases and identify cases and reduce transmission and protect our at-risk populations is critically important, and I do feel we have those communications.
As we've heard many times, but sometimes people are just not listening to the information that goes out. What are some of the things that folks can do to prevent this and really take it to heart and defeat this?
Okay. Well, there's a lot of different terminologies out there, and they really pretty much are the same thing, from shelter in place to home isolation. The bottom line is, if you don't need to be out, please stay home. If you need to go out, think, can I go to the grocery store once and not go back for a week? Can I have my groceries delivered? So staying home to reduce contact to others, to be very conscious if you do leave the house, the first thing you do when you come in is to wash your hands for at least 20 seconds with soap and water. Do not touch your hands and face, because your risk factors for exposure is to be coughed and sneezed on, or to be in close contact with someone who has the condition, or to touch something that somebody sneezed or coughed on and you then proceed to touch your face. A lot of people have allergies, including myself, and I tend to rub my eyes, so I have to very consciously be aware not to rub my eyes. So keep your home site safe, wash your hands, go out as little as possible. We need to hunker down. If you can telework so you don't have to go in, please work with your employer. If you're elderly, definitely stay home. You know, we have a lot of kids that are out of school now, so the question comes up, can my kids go outside? Yes, take them out, let them run around, but don't be in groups. You know, stay separate. You know, be a family unit if you're hunkering down at home, but get outside, run around, It is springtime, but then go back in the house.
I think while we were setting up the studio this morning, we were in here with a tape measure, making sure 6 feet apart, things along that line.
I appreciate that.
Yeah. What should someone do if they think that they have the virus or perhaps exposed to it?
If someone develops symptoms, and symptoms again could be low-grade fever, it could be cough. If you feel bad in any way, my advice to you is to call your healthcare provider, because you and your provider can decide, do your underlying health conditions warrant you coming in either for a visit or whether it warrants you being tested. If you're a young and healthy person with symptoms that could be influenza, it could be a cold, it could be coronavirus, we're really advocating to stay home and self-isolate. Not everyone that's low risk for complications can be tested. But the key is that if you're at risk and you're developing worsening symptoms, you need to work with your healthcare provider to see if you're one that needs to be seen either in the office or to go to the emergency room. We don't want our ERs to be a place where people routinely go for testing or for minor symptoms.
I'm going to give you the last word on this segment. If there was something that you wanted the residents and visitors to Polk County know, what would it be and what advice would you give them?
My advice would be, every day we're learning about this. I want to quell panic, realize that there's an underlying mechanism to investigate and to control this, but we're also held to be personally accountable and to stay home if you can, to telework, and to keep yourself and your immediate family safe.
Well, Dr. Jackson, I want to thank you for coming in and joining us on this segment, and thank you for the information.
Thank you for the opportunity.
Now, for more information locally, you can give the Florida Department of Health in Polk County a call on their dedicated COVID-19 Information Center line at 863-519-7911 or go to floridahealthcovid19.gov. We'll be back with more of the coronavirus disease COVID-19 special right after this.
Hello, I'm Sheriff Grady Judd. As we're all monitoring and taking precautions related to the COVID-19 pandemic, please remember a few things. There are going to be rumors and fake claims being made on social media and elsewhere in our community. Let's all keep a calm, cool head. Don't accept at face value bizarre claims. Check them out for accuracy with local government officials. We all want to keep an upbeat attitude during this time, but please avoid making false claims or creating hoaxes or crude jokes about COVID-19. This is not funny. People fake coughing or making false claims about having the virus only spreads panic and unnecessary worry. We need to take the virus seriously, exercise social distancing, stay away from group gatherings, and practice good antivirus hygiene. Washing our hands frequently, using hand sanitizers, and avoid touching your face. We will all get through this together and come out stronger and wiser on the other side of this epidemic. Please stay safe. Help those in need. Please follow sound medical advice and emergency declarations from our local, state, and federal partners. And please, please, please remember, social distancing prevents the spread of COVID-19.
Welcome back to the Polk Government Television Special on the coronavirus disease, COVID-19. I'm Brian Lacey, and joining us in studio is Dr. Paul Banerjee. Dr. Banerjee received his bachelor's degree of science in psychology with minors in biology and chemistry from the University of Pittsburgh. He earned his medical degree from the Philadelphia College of Osteopathic Medicine in Pennsylvania. Dr. Banerjee completed his residency training in emergency medicine and is board certified. He's been practicing for over 20 years and has served as a regional medical director and site medical director of several community emergency departments. He currently serves on the faculty with the University of Central Florida and is a clinical professor of emergency medicine. In addition, he is also the EMS Medical Director for Polk County Fire Rescue. Dr. Banerjee, welcome to the show.
Nice to be here.
I want to talk a little bit with being the medical director for Polk County Fire Rescue and EMS. Let's talk a little bit about what our first responders are facing, if we could, please.
So this is basically a brand new virus that we weren't prepared for. So what we have to do is become creative. My most important job is to keep my crew safe, because if my crews go down, we can't run calls. So we created a protocol to help guide the best practices for our crews, for the safety of the citizens. We've used CDC guidelines, we've used the help of Dr. Jackson, we've used the help of all the hospitals to find out what best fits for Polk County and try to get the best results for the patients and the safety of our crews.
One of the things that we were talking about kind of pre-interview is masks and how they're working and what you're doing when transporting individuals. Talk to me a little bit about the masks and transporting, and then if you go a little bit more in depth as to, kind of defining the masks and what they do, if you would, please.
So every patient we run on, we're going to assume is COVID positive for our protection, so we mask all our patients. This is a different or a change in practice because before this virus, we weren't as concerned about droplet-borne illness. We've changed in that we don't want to expose our crews to people who are coughing, so we mask all our patients. We've also, if you are having shortness of breath with asthma or emphysema, we're giving the breathing treatments prior to leaving the place. So if you call us to your house, we'll take you outside, we'll do the nebulized treatments outside. We'll not aerosolize anybody in the ambulance. Once we're done with the treatments, we'll transport you directly to the hospital. If you are in respiratory distress or failure where you cannot breathe and you need us to breathe for you, we do all our procedures outside at the place where we're called before we transport. We have also bought hepatofilters, which are basically devices that capture all the droplets. And they're only like $14 each, but it protects our crews. So as the person is breathing on a ventilator or having anything that's going to be released, it captures all the viruses. We changed our masks for breathing treatments to closed masks. Normally the masks are open to let the air droplets out. We know this is a higher exposure for the crews, so we've ordered sealed masks with hepatofilters to minimize the exposure or release of the virus in the environment.
Standing on the front lines fighting this virus are our EMS professionals, fire rescue, our first responders, and our medical professionals. But the first call that people usually make is to our 911 center. I want you to talk to me a little bit about the protocols that are in place for our 911 operators, if you would, please.
So they've done a great job. What's happened is it's an evolving situation, and things may be different next week. I think hopefully we've stabilized how we are approaching these patients. But initially, about a week or two ago, we were asking international travel. That was an important question to ask. Along with fever, shortness of breath, coughing. These are high-risk indicators of potentially having COVID illness. As time has changed and evolved, travel hasn't been as important because there's been a pandemic spread worldwide. So it doesn't matter if you traveled, you have the signs and symptoms. We're going to assume that you could be a sick patient that's under the sick patient log. So we've asked the dispatchers if someone asks for fever, flu-like symptoms, coughing, shortness of breath, any of those symptoms that you're having, the dispatch will notify EMS Fire Rescue that this could be a viral alert patient, and so we will respond appropriately. So when we respond, once we enter the place, we'll put a mask on the patient, we'll do the assessment. Instead of having everybody enter the room like we used to, personal protection equipment is very limited, so we have to do it judiciously. So we have one person go in. And if we're assuming it's a viral alert patient, that person will have an N95 mask, goggles, gloves, and a gown to do the initial evaluation. Once they've got the initial evaluation done, if they think it's a high-risk COVID patient, we will activate a viral alert. Our viral alert is based on a few things. First thing is, do they have a temperature over 100.4? And or have they taken Tylenol or Motrin within the last 6 hours? Because you could be afebrile, but because you've taken Tylenol or Motrin, it could be masking the fact you have a fever that we're not finding. So if they meet any of those criteria, we ask that itself, and if they have two other symptoms including clinically respiratory rate of greater than 20, heart rate greater than 90, which are both SIRS criteria for sepsis diagnosis, and tidal of less than 32, which is again a SIRS criteria for sepsis. We have O2 sat less than 93%. If they're coughing 10 times a minute, these people, any two of those signs and symptoms, we would assume that will be a viral alert, and we would transport to our local facility. In the ambulance, we would have everybody masked up with minimizing patient contact with the one person with full PPE. And so basically we want to avoid exposure to multiple people. Everybody on site would have a regular mask on. The person going in with the viral alert would have the N95 mask on and PPE just exactly per CDC guidelines.
With the job comes relationships, and you have relationships with every hospital within Polk County. I want to talk specifically about our medical professionals, talk about their dedication to service and what they're facing and what we as residents can do to help them.
Well, I think in time of crisis, true character comes out. And you know, when you're in a situation that nobody's been exposed to or experienced before, two things can happen. Either you panic and fall apart, or you come together as a community and do what's best for everybody. And I think we're lucky to have that in Polk County. We've got great support from our county manager, deputy county manager, county commission, health department. The hospitals have really come together and really been, an email communication comes back immediately, a phone call comes back immediately. We were having delayed in testing for COVID patients. Just email the CEOs, within an hour, yes, we'll get it done for you. So the community has really come together to really help us. For people, how can they help us? If you're having symptoms and you're worried, please ask. We're happy to help you, but not everybody's going to meet criteria for testing for COVID. And working in the emergency department as well, we kind of see how that goes as well. There's a triage system that dispatch has, which filters it down to EMS, which filters it down to the hospital, and the hospital triages it down to people who are tested. So it is basically almost a reverse triangle of testing that occurs. Be patient, don't panic, be informed, be educated. The community spread is limited by human distancing. So if you have the virus and you keep away from people, and if you don't have any symptoms for 14 days, even if you did, you can't transmit it to everybody. That's why they want you to stay home. People wear face masks now. The face masks are really only worn for people who are coughing or having symptoms. The problem with wearing face masks all the time is that it irritates your face, and you're more likely to play with your face, touch an object, put it into your mouth and nose, and then you're infected with the virus. So the mask is great if you're having symptoms to protect others from you, but if you don't have any symptoms, it doesn't really help.
One thing that I talked with Dr. Jackson about is throughout hurricanes and tornadoes, things that have happened, natural disasters, we've developed incredible partnerships within the county between our emergency management people and everybody that can make a difference. Talk to me a little bit about those partnerships and really how it helps with the combating of this.
Well, I think we're all evolving and learning as we go, and it's been a whole learning experience for all of us. We tap the experts. I've learned more about COVID in the last 2 weeks than I ever knew in my whole life. And it's important to be that informed because people's lives are at stake because of it. Now, in our situation, we've had support. Our fire chiefs come through. My EMS chiefs come through, my training departments come through, having to educate close to 700 people in the field of how to protect themselves, how to get the right information out. Everyone's trying to push the envelope to get people released early. Was I exposed to a COVID patient? Am I putting out of commission for 14 days for observation? How can I make shortcuts? Ultimately, we're all looking for the best optimal outcomes. And as resources and situations change, we will evolve and develop. But we're using our experts, Department of Health, hospitals, epidemiologists, CDC, to guide us to work together and partner with our support from our community to provide us PPEs. Face masks are short, PPE gowns are short. They're doing everything they can to make sure people are fully equipped and safe.
I'm going to leave you with the last word on this. Is there anything that we didn't cover that you'd like the folks to know, and anything you'd like to say to finish up?
Please be patient, be vigilant, think of others, prevent community spread. This too will pass. This is a short-term pain, hopefully. And the more we hunker down, the more we're patient, the more we stay calm with this, the better it'll be. And as soon as it's done and we get a vaccine for this, we learn how to treat this better, we will be all safer. So please be patient, please bear with us. We will do the best we can. Your safety is our #1 concern. Let the experts help you with that. And there's a 24-hour hotline apparently over at the Department of Health. We're obviously your advocate. We want to help you in every way possible. We want to make sure our crews are safe, because without them, we have no help. Can't thank the crews enough for what they're doing. Can't thank the support from everybody we've received. Fire chief, EMS training, community, county commission. Everybody's been so supportive in this time of crisis with the Department of Health that, just bear with us and this too will pass.
Dr. Banerjee, I want to thank you for coming in and sharing the information with us.
Thank you.
For more information locally, you can give the Florida Department of Health in Polk County a call on their dedicated COVID Information Center line at 863-519-7911, or go to floridahealthcovid19.gov. We'll be back with more of the coronavirus disease COVID-19 special right after this.
Stop the spread of germs that can make you and others sick. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, use your elbow. Wash hands often, especially after coughing or sneezing into a tissue.
Welcome back to the PGTV special on the coronavirus disease, COVID-19. I'm Brian Lacey, and we want to talk about what our local government is doing for the residents of Polk County. Joining us in studio is Chairman of the Board of County Commissioners, Bill Braswell. Commissioner Braswell is a graduate of the University of Florida and retired from the Air Force after 22 years of service. Commissioner Braswell, welcome to the show.
Glad to be here.
I want to talk to you a little bit about, I want you to share your perspective on county leadership, a little bit about what you see is going on and the steps that we're taking to combat this.
Sure. Well, first of all, we're taking it serious. It's a serious disease. We recognize that. The CDC has come out with guidelines. We're trying to follow those as best we can. We're asking our citizens to do that. This isn't a county down kind of opportunity. This is everybody needs to participate equally, and we need the citizens paying attention, following the CDC guidelines. That's what we're doing. We're doing the social distancing. We're trying to get as many people out of buildings as we can, working from home. We recognize the seriousness of it. We know it's probably going to get worse before it gets better. We're asking the citizens not to panic. It's a temporary thing. And we recognize at the county level that the economics of this are going to really impact our county in a very negative way, probably for a much longer time than this virus is. So we're trying to factor all these things in together and make the right decisions. But it's tough. I mean, we're in uncharted territory like everybody else, but we're going to do our best, and we want to communicate with the citizens doing stuff like this, and we want to hear back from them.
One of the things that we know and we heard from Dr. Banerjee was the dedication of service of our first responders, but we have other county employees that are in doing their part. Talk about the dedication of the county employees and the leadership of the county in supporting them and what we have to do.
Sure, yeah. What we're trying to do is run as close to business as usual as possible, which means our employees have to come into work. Again, we're following the CDC guidelines on that. But our county staff, which is over 2,000 people, they're working every day. Every functionality of the county is up and running. If you need permits, if you need this or that, you can still do it. You can still get everything you need. And when you go over to the constitutionals, they're doing the same thing over there with licenses and that sort of stuff. So we're working. We're still on the front line. We're trying to isolate as much as possible, but we're working hard. And these guys are doing a great job. They always do. We've got the staff at this county, it's amazing. It really is. They're dedicated, they're professional, and they get the job done.
One of the things that we've seen on the news is social distancing. We're trying to stay away, and unfortunately the county had to close down some of the parks and some of the recreation things that are going on. From a leadership standpoint, what would you like the residents, what would you like to see the residents of the county do during these trying times and when there's less things to do? Talk to me a little bit about that, if you would, please.
Sure. Well, the reason we closed the parks, what we found out real quick is if you give people a place to gather, they will. And that was becoming a problem. You know, the parks were open. They were having parties. Nonsense is what it was. And we had to stop that. Yeah, that affected some boat ramps and stuff like that. Anything behind the gate, we've pretty much locked, and we're trying to keep the people out. What we need the citizens to do, again, is to follow the guidelines. If you don't need to be out, stay home. Don't interact with other people. But while you're home with your family, sure, you got to get your exercise, you got to go for a walk, you got to let the kids out and play. Otherwise, we'll all go crazy. So we've just got to use common sense, and that's what we're asking the citizens to do. But more, we're asking them to take it real serious. You know, I still see and I still hear a lot of people think this is a joke. They think it's a media-driven whatever. None of that matters at this point. It's a virus that's going to kill people and probably kill people in Polk County. And for that reason, the rest of us have to consider what are we doing day to day to prevent the spread of this thing. There's a lot of talk about the millennials and their, not being affected by it. I believe we've got two kids under the age of 10 in the hospital right now with this virus. I mean, it's got to be taken serious. So we're taking it serious, and we ask that they take it serious.
One of the things that has been said, it's a new norm. Talk about the board's philosophy on this commitment to the new norm, if you would, please.
Sure. Well, one thing, and I think you mentioned it earlier, we've closed our buildings to the public, and that's something we didn't really want to do, but we have to do, again, just to stop the interaction with people. Right now, we're planning on having all of our business meetings. Our county commission meetings will go forward. We'll do the social distancing thing during those meetings, but we want business to go on. The economic impacts of this thing, like I said before, are going to be tremendous. We're trying to operate normally in a very unusual and strange environment. We have no intentions of closing Polk County. There's a lot of pressure coming from outside, but one thing I do want to say is I want to thank the governor for leaving it up to the local governments to make this decision. It's my understanding we have counties that have no cases of this. That doesn't mean it's not there. But that obviously means it's not widespread, it's not raging through their communities. There's no reason to shut those counties down. We have it, we're aware of it, and we're taking all the precautions. But as a county, we want to keep things going, we want to keep people in business. They need their paychecks, they got to pay their bills, life goes on, and we will get through it.
We have just a little bit of time left. I'm going to give you the last word on this. If there's anything that you would like the residents or visitors to this county know, what would it be, sir?
Well, what I've said already is pretty much from a government standpoint what I want to say. But the other thing, I want to take my government hat off and put my farmer hat on. You know that I'm a farmer, have been for the last 20 years. What's going on with the hoarding of food, the shortages of food, I find a little bit ridiculous. There's no shortage of food. I can guarantee you, farmers in America, not only can we feed America, we can feed the world if we wanted to. There's no shortages. The logistics of moving so much food so fast has caused perceived shortages. And I'm just asking people, just take a breath, buy your normal amounts of food when you go to the grocery store, act like a normal day's going on when it comes to shopping, and I think we'll all be fine.
Well, Commissioner Braswell, I want to thank you for joining us, and I want to thank the rest of the Board of County Commissioners for your leadership during these trying times.
Again, thank you.
That's going to do it for this Polk Government Television special on the coronavirus disease COVID-19. Now, if you need more information locally, you can give the Florida Department of Health in Polk County a call at their dedicated COVID information line at 863-519-7911 or go to the floridahealthcovid19.gov site. I want to thank our guests today, Dr. Joy Jackson, Dr. Paul Banerjee, and Commissioner Bill Braswell for joining us. But most of all, I want to thank you for taking your time to spend with us. I'm your host, Brian Lacey, and remember, we're all in this together.